Hey folks, I'm Max. I'm a therapist. I'm a licensed clinical social worker, and I like to think I'm an expert in mental health and providing psychotherapy in a private practice, a mental health private practice, and in terms of mental health, I like to interview people that really are talking about health-related subjects, either mental health or some type of interdisciplinary crossroads of that. And I'd like to introduce two people today that are going to be talking about intergenerational spaces and how generations can either work together or we could be more productive around that. Maybe I'll let you folks say who you are and 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 how we connected through writing.
Yeah, absolutely. My name is Lauren Dunning. I'm from the Milken Institute Future of Aging. At the Milken Institute, we are a nonprofit, nonpartisan think tank focused on accelerating measurable progress on the path to a meaningful life. And at the Future of Aging, we're focused on advancing healthy longevity and financial security for all through research, convening multi-sector partnerships, and elevating impactful policies and practices in this space. And part of how we got here today is at the Milken Institute, we recently published a brief on intergenerational solutions and connections. And why are these connections important? How do we make them, right? And how do we, create social programs and norms that really advance how we bring our generations together, knowing that we have a more diverse population age-wise than we've ever had before, and that we are headed towards being even more diverse across all different kinds of demographics, not just age. And with that, I will hand it over to my colleague, Jason.
Max, nice to meet you and nice to meet everybody listening. My name is Jason Ritchie and I'm director on the public health team at Milken. Similar to Lauren, I focus on how to advance healthcare across the spectrum. For our team, we just recently published a paper advancing innovation in mental health care treatment. And there are many similar themes that intersect with Lauren's work, especially social isolation and loneliness.
Okay, cool. So, just as a person living, right? And I want to frame it this way. So, like, I'm out there, I'm just a guy who gets emails. I got that press release from you folks. I'm reading it. And it's good to know that people are out there, first of all, talking about these things. And, just on the level of someone living and texting with my mother, who, know, she has a group, she struggles with it. And a lot of people do. And there are a lot of, I guess, like, technological barriers out there to generations sort of connecting. What would you say, including that, not including that, would have been some of the like the key, I guess, challenges that you
Yeah.
folks covered? Maybe you can talk about that.
So I can start with just talking about intergenerational connection, and then we can talk a bit about how that connects with mental health, and then also mentioning some of the social societal level issues we're experiencing across both. So looking at intergenerational connection, one of the things that we raised up in our report is the importance of it. And we have age siloing in our society, right? You go to school and you're in specific grades and you are connecting only with people your age for many, many years, right? And you might have experiences where you might have grandparents, but for the most part, people have less intergenerational families and connections and broader connections as people are more mobile and move. And so we have an increasingly age siloed society where people are educated separately, where people live often very separately, especially from older adults. And this age siloing is something that we need to overcome because intergenerational connections and being with people of different ages is good for us. We know physically, mentally, and cognitively it's good for us. And in our report, we identified six specific areas actually where making intergenerational solutions, intentionally bringing people together, can fill those gaps and help people, right, learn about intergenerational connection, overcome maybe some of the ageist, stereotypes at play, some of the norms at play around age siloing, and bring people together for the benefit of individuals, because intergenerational connection is good for individuals, but also the benefit of society as a whole. And so in that, for example, social isolation and loneliness is one of those areas that we bring up as being really important in this space. And I've got some great data about why that's so important, especially for younger people. But I want to take a pause and have Jason jump in on some of those challenges.
Great. I'll say to you that being able to break down those age silos also leads to the reduction of stigma, both in terms of mental health and, of course, towards aging. And I think as we've all seen societies age, they've taken a different approach depending on whether it's the US or Europe or Asia. And that's another area to keep in mind about how policy levers and frameworks can really impact aging and intergenerational relationships.
Right, true. So, but I guess my question then it goes back to the verb action. Like, what do we do with this data? And, how do we connect it to practice innovations out there in the mental health industry?
So first, as part of our brief, which is transcending age-based divides, the case for scaling intergenerational solutions, we give 6 areas where creating intergenerational connection can provide benefits to people of all generations, including some examples of how we do that. So they include social isolation and loneliness, strengthening education outcomes through volunteerism, engaging employers to support an increasingly multi-generational workforce, leveraging creative and cultural arts to bring people together, enhancing our housing options to be more multi-generational, and then mobilizing political engagement and public service. And so in those 6 areas, there's real opportunities and there's examples, right, of programs. And now programs provide an important stepping stone, right? They're in so many communities. For example, AARP's Experience Corps is in, I want to say, 50 cities nationwide, and it can bring people together with students to support their educational outcomes. There's terrific outcomes in terms of older adults participating in those programs around, right, actual physical benefits and cognitive benefits. And so benefits on both sides. And so some of how we mobilize around this is through participating. How do we know that these things exist? How do we get involved? And how do we help communities have more of these types of programs so that people can benefit from them and maybe create those connections on their own now that they know how important it is.
Cool. I mean, that all makes sense to me.
Yeah.
I mean, I wonder, it makes sense to me as a social worker and just as a person out there living in the society that we live in. But I guess I'm saying once you get to the program level, what do you folks do at the Institute? Do you go into these programs and physically like show people, or do you just send your, I mean, how does it work? Getting the information, I guess, down from this is what we think is going to work for you or work for people to this is how you can implement it in everyday practice in programs across America.
Yeah, absolutely. So part of how we work is by the elevation of phenomenal ideas. And so at the Future of Aging, we have an advisory board who is comprised of leaders in aging that really help us navigate towards areas that need, need additional focus, need additional elevation. And so we actually held a series of panels at our flagship events that elevated this issue. And then we convened a roundtable with over 30 experts in aging to elevate and select what these 6 areas might be and help us locate. And so our role in this is one of sort of elevation, of getting the word out, of finding and picking out and analyzing ways to help people, see the evidence in clearer ways, help come up with ideas that might connect with policy. And then part of our job is to help people sort of move through that process and understand a bit more. And so while we're not implementing programs. I really, love going to see them on the ground, but there's
Sure.
people who are amazing at that. So Generations United has a whole website that is providing a catalog of programs that if you want to get connected locally, you can find them. And there are people that are, at the community level that are implementing them and doing that hard work of figuring out how to create it, how to sustain it, and how to figure out what works. And so our role in this is one of translation and making it something that's something that we can act on in different places across the country. I can see. Sorry, I'll let you jump in there if you want.
But I think that's amazing. Folks really are mastering the dissemination of information, it sounds like. And
That's the goal.
it sounds like you're actively getting there, if not have gotten there. And I guess my next question is, in terms of your role and the role of just the Milken Institute as an agency, or maybe their goal or vision, how do you see yourselves in terms of the work you put out there and the role of yourselves in terms of advocacy and policy change? Because it sounds like you're interacting with change makers, and people that are out there that have a real stake in what's going on. So what would you say on a theoretical level your role is in that?
Yeah, I think a lot of it is, looking across, doing qualitative research with all of these experts to understand where are important areas or trends or solutions that people need to identify and helping create them. And that's part of what we do, right? Is, for example, here we spotlighted sort of specific areas and then ways people have done it before. And then we have this incredible network of people that are involved with us that can help carry those ideas forward, right? We do things like this. We are also engage with people to elevate these messages, and we're a nonprofit, so we're not in the halls of Washington lobbying, but we are sharing information and ideas, and that's part of what we believe our role to be, is that how do we find and help create good ideas that can advance important areas like intergenerational solutions.
And I'll just add briefly that part of the real interesting mix of all of these amazing programs is to look at how they're funded and how the community responds and what elements can be taken and adapted elsewhere and replicated. And the magic of our convenings is that we're able to have people come sit in the same room, hear case studies, share ideas, see what toolkits are in place, and enact that in their own communities at whatever step they're ready at.
That's so amazing. And to shift the focus a little bit from like dissemination to advocacy to just, mental well-being and feeling good on an everyday basis, living your life, people living. How do you think you folks are impacting just people feeling better and people feeling good and just, you know, the overall level of happiness out there in the world and feeling content and having this information, what it does for people in terms of feeling better and feeling empowered?
Yeah, so I think there's some interesting data on that, specifically around intergenerational connection. So we know that, right, intergenerational connection can support or address, right, and be an important part of helping people make connections that ward off social isolation and loneliness. Social isolation and loneliness have, right, significant physical, mental, cognitive impacts. It's been studied extensively, right? There's, people so lacking social connection, has been in one study equated to smoking 15 cigarettes a day in terms of the cumulative negative impact on us. And that's one that's really well known. But one of the things that I think is interesting around social isolation and loneliness is people often perceive older adults maybe as being the most socially isolated or lonely group. But believe it or not, there's some, and I'm going to pull it here, that there's some really interesting and just sobering research that came out last year. So, and also this year. So in 2024's World Happiness Report from earlier this year, loneliness is almost twice as high among American millennials as those born before 1965, right? And so that's something that you might not necessarily expect. In a 2023 Gallup poll on a similar issue, young adults reported greater loneliness levels than adults over 65. In fact, the lowest rates of reporting feeling very lonely or fairly lonely were found in older adults, right? 17% age 65 and older, as compared to 27% among young adults 19 to 29. And so oftentimes we picture intergenerational programs or programs that enable intergenerational connection as being something benefiting older adults, right? But it's really something that when we do it intentionally is for both groups. And there's a real opportunity here because we know that it's needed, right? This, social disconnection is something that's just
Huge.
an intense challenge. So yeah, but we also know that people think 92% of Americans believe intergenerational connection can help reduce loneliness across all ages. And so, Jason, I don't know if you want to talk to the mental health or other areas around this.
Sure. So I'll also add that you're seeing really, unfortunately, at all age levels, the psychological toll that loneliness has. Really, we saw this during COVID, but it's been around well before COVID, and unfortunately, well after. It just received more media attention during COVID. I'll point out a study from the NIH that came out earlier this year that if you look at cancer mortality, loneliness really has raised that 25% in cases where loneliness is actually now, in some cases, considered a comorbidity.
It makes sense to me. I would agree with that, especially the post-COVID data. And before we get into like the future and where this is all headed, because it sounds like it's good information heading to the right people. What do you folks do in terms of, I'm just curious, just as like a researcher, how do you analyze your data? Like, what do you use to really like once you have the research and articles and you're thinking about things and doing things? What do you use to like crunch the stats and really, how does that work? Just so people out there know a little behind the
Yeah.
scenes and how it's done over there.
Well, we have a number of ways that we work.
Yeah.
On some project, we have an incredible research team that's full of all different kinds of quantitative folks that are macroeconomists or right health economists, and they do great work. And sometimes we partner with them, but sometimes our work is more qualitative focused, right? Where we're bringing people together, right, and looking at and hearing and asking prompts and questions to understand their perspectives. And then we also use key informant interviews, right, which is qualitative, open-ended interviewing technique to understand ideas or knowledge and attitudes, beliefs better, help us surface good ideas that might not appear in the literature. And then we go ahead and look across that for themes, right? Frequency, interesting ideas as well, outside of just emerging themes where everyone is sort of converging on a specific area that's important. But we really use sort of that desktop research, right? Straight out literature review, right? Where we're analyzing what's out there, how does it fit together? And then we're combining that with qualitative methods to then, do analysis and figure out where are opportunities. But then after that, it's a bit off-roading, right? Where we're talking to people about where can make a difference, what is important. And there's a number of reports that are longer format reports that actually design different types of solutions. So for example, this last year we did a report on senior housing and care for middle income older adults that suggested some innovative financial tools as well as arrangements that would incorporate healthcare into how people pay for senior housing. So there's some, co-design work that takes place as well. I'm sure, Jason, you have your secret sauce of how you do this too.
I do, and I'll say that our research is really across the public and private sector. We really look at geographies across the country, individuals with lived experiences in the case of mental health issues and addiction, and just we do a lot of survey work to be asking that we're seeking the right questions and how they can elicit the most comprehensive, broader answers to make sure that we have a representative sample.
Cool. That's amazing. And then you really do have to read my books.
We would love to.
Okay. Um, so I guess before we wrap up here, I just want to let you folks offer your final thoughts on what we've talked about, or the subject, or your future work, or really anything.
Jason, do you want to lead off? I feel like I've done a lot of talking.
I'll say that, it's been really rewarding to see the growing awareness of mental health, both because of COVID and because of the impact afterwards. And it's heartening to see the public investment that's coming in, whether from government sources, foundations, private philanthropy, and the role of employers, given the fact that they are the largest buying purchaser of mental health services through insurance.
Oh,
And building on that, I'll just say, one, thank you so much for having us here to have this really, what we consider a critical conversation and letting us reach, your readership. And so thank you for that. And the conversation, I feel like you've asked some really in-depth questions that let us talk about not just the what, but the how, because we think the how is part of, right, how we make change across public and private sectors, because both are important together. And I'll leave us with just a subject matter based, tidbit, which is just that really intergenerational connection benefits everyone, right? And there's opportunities in communities, they're findable, and they might have surprising benefits for people that you might not have anticipated, whether it's about helping people experience generativity, right? What it feels like for older generations to give to younger ones. There's actually wonderful benefits associated with generative activities, and helping people have opportunities for that can be important. There's also important impacts around sort of ageism and people increasing their understanding across generations, in addition to the sort of physical, mental, and cognitive impacts we've talked about. And so with these incredible benefits, right, there's opportunities, right? Go ahead and, work to find them. And then also, if there's also, if you aren't looking to go somewhere physically, right, there's opportunities that are just purely online, right? Eldera is a global virtual platform that brings people together for conversations across generations, and they have great stats on creating lasting relationships amongst people where people continue to engage. There's other types of online opportunities, obviously being mindful of using vetted sources and safety, but really the idea is that it's good for everyone, and let's get involved. And then on a solutions level, let's figure out how everybody can have these types of opportunities as we become increasingly diverse as a society. We're going to have roughly equal numbers of people across all of the generations in the coming years. We've never had that before. And so we need it more than ever to create understanding and to create, right, more cohesion. And so, right, how do we mobilize together politically to help our local communities, improve and change in ways that we all want to see together? So there's a bunch of examples in this report that we shared, and maybe you can link to it and people can see, because there's usually something for everyone. If you play music, if you do art, right, there really are ways to get involved. And so we're excited about it, and we're excited for the opportunity to continue elevating these strategies at a practice and policy level so that everyone can participate.
absolutely. And thank you for being here, both of you. And I couldn't agree more. The urgency has been outlined, and
It's
the mechanics of how you do things. I think it's just great for everybody to know and understand better. Like you said, this is something we have to look at now, and let's do it. So I'll put all that information in the chat and for everyone to read. And thank you everyone for listening. And thank you. Thank you.
Thank you for
Thank you,
having us,
Max.
Max.
Take care.
Thanks, Max.
Thank you.
Thank you.